My area of specialty is officially known as adult reconstruction, but what that means is hip and knee replacements and also revision hip and knee replacement surgery, which means addressing those that have had maybe some issue of some sort with a previously done hip or knee. And I'm fellowship trained in joint replacement surgery and have been doing that since I came here, gradually increasing to be now almost exclusively what I do. Probably about 90–95% of my practice is hip and knee replacements now. And we've seen our practice increase in not only size but services that we provide. I think it's given us a better way to globally serve our patients with multiple services available right here in the same group. It makes for a little more tight management of what's going on. We can have better communication, particularly with physical therapy, as to how our patients are doing with their therapy visits. It's helpful to have our own MRI available on site because it makes it for easy scheduling, and also we know that we're getting a quality interpretation from a musculoskeletal radiologist with whom we contract for the interpretations. We have very quick turnaround. We can even get them same day in some cases if needed. One of the reasons that we've put our group together the way that we have is in hopes that we are providing care here in our community that serves our population here so that patients don't have to leave or don't feel that they have to leave. We feel that that's a huge benefit to the community at large, and we're all glad to be here providing the services that we are. We all try in our group to stay up with the most current movements in our fields, which I think we all do, and so that we can talk with our patients with some intelligence about whether the latest thing that they've been hearing about is really as great as they think it is. But it's the patient care side that's really has been the most tangible improvement, moving from, gosh, when I first started in practice, patients stayed in the hospital 3 to 4 days for a hip or knee replacement routinely. Now it's not at all uncommon for patients to leave the day after surgery, and in some cases maybe even be ready to go home the day of surgery in very select cases with the right patients in the right situation. To be able to help them walk better and get around easier and be able to live their lives more like they would like is the most gratifying part to me.
Youngstown Orthopaedic Associates is a multi-specialty orthopedic group. That means that each of us has our own individual subspecialty within orthopedics. Mine happens to be shoulder and knee surgery. That includes both sports medicine and degenerative conditions such as arthritis. So we see a lot of people who are looking for ways to recover quicker, ways to reduce cost for their healthcare episode, and this type of program offers both. It's a much less expensive option, and it allows them to recover in their own home and with an outpatient therapy program rather than being in the hospital for 2 or 3 days or going to a rehab center after their replacement. I think the arthroscopic procedures that we do have come a long way in the past 15 to 20 years. We're able to do much more now through the arthroscope, which is small poke hole incisions while you're watching on a TV screen using a high-definition fiber optic camera to fix things like rotator cuff tears, unstable knee ligaments, meniscus tears in the knee. The doctors talk to each other often. If I see somebody who's out of my area of expertise, I have 10 partners that I can go to get that patient taken care of. So we're always able to point that patient in the right direction. If somebody comes to you for your opinion and they have a problem outside of your area, we've got somebody to cover that. We're very proud of Youngstown Orthopaedic Physical Therapy and Occupational Therapy. We view that as an extension of both the surgical and non-surgical care that we provide here. When we take a patient to surgery and do an operation, getting a successful A+ outcome depends on a lot of effort on the physical therapy side of things, and we have a team here that we work closely with to establish protocols that work. And there's constant communication between the therapists and ourselves as a patient goes through that recovery process. So they're a very important part of our team, and they complete that surgical care when a procedure is performed. The Saturday Sports Clinic started back in 2002 as an initiative for our group to get athletes who were injured on Friday night taken care of over the weekend. There's a lot of anxiety and uncertainty that surrounds a Friday night injury, and waiting until the next week to get that addressed or to get some answers is often tough on a family. In June of 2017, we started an urgent care. That provides the same type of service for patients who are injured during the week or perhaps at work, who want to be evaluated by an orthopedic specialist and initiate treatment as soon as possible while avoiding that emergency room visit. One story that comes to mind was my first year of practice when I had a high school senior football player come in with a bad ankle injury. He had surgery on that ankle, he recovered, he went on to play 4 years of college football and then got drafted and played over 10 years in the NFL. And that was rewarding to see someone who was so down at one point come through that and then have a successful 10-year NFL career that followed.
So I'm a joint surgeon, so I do mostly hip and knee replacements. I also do sports as far as various injuries to the knee, but primarily hip and knee replacements. One of my favorite things to do is actually the robotics. Since I've been here, I've used the Mako robot for my hips, but I've also was the first one to do the partial knee replacement using the robot. I plan the surgery where my components are going to be, and then during surgery, I can make adjustments if I need to, but it allows me to put the components in the exact spot where I want to put them. As far as balancing the knee, you have way more information than you ever had. I mean, the whole goal is to make a very reproducible knee that eliminates the patient's pain and can improve their function. There can be a faster recovery because there's less soft tissue dissection. From my personal standpoint, I get all my patients moving day of surgery. Studies show complications actually go down the faster you get up and get moving. Less risk of blood clot. Patients who are moving do better, tend to have better motion, the thinking has just changed from the previous decades where patients stayed in bed. So all my joints patients will do physical therapy. Patients who do physical therapy do better and recover quicker than those who don't. Having physical therapy in our building is advantageous because I get to know the therapist, I can see their notes, and I trust them. That doesn't mean other people don't do a good job, it's just I have a familiarity with this group. Our group has multiple specialties in orthopedics. So the advantage of that is I have a patient who has something other than a joint issue, say foot and ankle or their spine. We have guys in our group who also treat those conditions, and so I can send patients amongst the other doctors in our group. Any difficult case, you often talk about the hard cases with your peers just to sort of see what they think, what they would do. I've even helped out one of the other guys in our group who's not a joints guy, just assist him in a difficult case. And so it is nice to have a group of guys who have different talents and like you said, work together on those hard cases.
Did you know that you can find the most experienced and professional orthopedic team right here in the Valley? At Youngstown Orthopaedic Associates, we've been providing all-inclusive care to Valley residents for over 25 years. We offer a full range of services. In fact, our MRI screening is open to anyone at a fraction of the cost and more accessible than at large medical centers. You have a choice when it comes to your orthopedic care. Youngstown Orthopaedic Associates, your choice right here at home.
My name is Mike Millador. I joined the Youngstown Orthopaedic Group 2 years ago. I went to Youngstown State University for undergrad, then I went to NeoMed for med school. I've been in Buffalo the past 6 years doing my residency and fellowship training, and then I joined the group 2 years ago. So I do hand, elbow, and shoulder surgery. What that means, it's carpal tunnel syndrome, trigger fingers, thumb arthritis, tennis elbow, as well as shoulder arthritis and rotator cuff tears. And performing this specialty allows me to get patients back to work, return to the activities that they love doing, as well as help fixing a broken bone and helping get them back to their lifestyle. One of the newer procedures I perform is called an endoscopic carpal tunnel release, which allows for a different incision. It's in a different part of the wrist, in skin that is less sensitive than some of the more traditional techniques. This allows patients to get back to a quicker recovery, get back to activities they like doing, and also get back to work sooner. I think we do the best hand therapy in the area. Our therapists are very skilled and have a great education. I communicate with them very easily. There's often times throughout my office day where I go down to therapy to see a patient and make sure everything is communicated appropriately. For some of our post-operative patients, we make custom braces. We do them in the office on the same day. The therapists are very good about making them, and they're also easy to make adjustments as time goes on. We are fortunate to have physical therapy and occupational therapy in the same office as I practice in, because if there's a question or concern with the patient with what are they doing with therapy, or do they need a brace, or what kind of brace do I want, I'm able to come down, talk with the patient, talk with the therapist, and get everything figured out. Working in a multi-specialty group has been great. We're able to share patients with one another who has maybe a more particular expertise in an area, and then also with having other partners to bounce ideas off of, we can make sure we're doing the right thing for the patient in case we have any questions.
My name is James Scher, and I've been with Youngstown Orthopaedics in their practice since October of 2014, but I've been working with the gentleman in this practice since April of 2005. I have an interest in trauma care, which is basically fracture care and musculoskeletal injuries that were not planned. So I kind of like this area, and I deal in this area quite significantly, or the majority of my practice time is doing fracture work. I like to do minimally invasive surgery when I do fracture work, because we've kind of learned that just fixing the bone isn't enough. So by doing minimally invasive surgery where you don't disrupt the blood supply or soft tissue extensively, fractures heal. Well, with outcome, you're looking at function, not form. And you have to balance fixing something and motion and weight bearing. Elderly patients, if you fix a fracture for them and they can't bear weight, this is a major problem. So you have to get these people, you have to fix them in a way that's biologically friendly, stable, and able to get them up putting full weight on their legs or their arms as quickly as possible. Okay? And the majority of my surgeries are designed such that you break your hip, you're up, you can put full weight on it right away. I try to engage the patient to heal themselves. I have them go to physical therapy, I have them be evaluated, and then I try to get a home exercise program developed. And so they come back periodically to prove that they're doing the exercises appropriately, and then they carry them out on their own at home. With my particular practice being more general, my elective practice is very general, so I'm seeing feet problems, I'm seeing hand problems, shoulder problems, sports-related injury problems, and occasionally I see back problems. I can collaborate for best management of these patients. So I will evaluate them, get them started on primary care for this particular condition, and if there's a particular problem which I feel is outside of my surgical ability, I will pass it on to someone that does that procedure or deals with that situation more frequently. Early in my time here, one of my partners referred to me a patient with a previous fracture that was healed in a malunited position. So this person had an injury in the remote past. It was treated non-operatively, but his leg was crooked. So in this particular patient, I corrected his alignment. I straightened out his leg, his knee feels dramatically better, and he's functioning.
A lot of things I see are arthritis, ankle arthritis. So we do some ankle replacements, ankle fusions, hindfoot fusions. I still do forefoot things like bunions and hammer toes, some diabetic foot care, sprains and strains, Achilles tendon ruptures, just some of the things that I do. The implants that we're using for procedures that we've been doing for decades have improved. The quality of the implants, the engineering behind them, so the procedures necessarily have not changed, but the implants are better, stronger, allowing us to get our patients back doing the rehab quicker. So there have been some advances in some of the way we treat isolated cartilage lesions. I likely would do more ankle replacements in patients with rheumatoid arthritis. They're less active, generally speaking, and they're more likely to have arthritis in other joints in their foot. That's why we want to try to preserve that motion if at all possible. As opposed to a fusion, if it's an isolated injury, especially in a younger patient, where it's just the ankle joint, a fusion is more likely to give better relief, and there's no risk of that failing over time. Well, it's always nice to have a colleague that you can run a case by, especially if it's maybe out of my field of expertise, something I may have got on call. If I don't feel comfortable with proximal humerus fracture, for instance, I've got several partners that are more experienced in doing those type of things. And even if it doesn't require surgery, sometimes we'll have discussions regarding the most appropriate form of non-operative treatment. So, that's quite helpful, and usually there's more than one of us here, and oftentimes we'll have discussions regarding patient care during the day. It's a multi-specialty group. I think we've, for the most part, got most specialties covered. We have expanded. We have more than one office now. We've recently opened an office in the Warren area. I think that's going quite well. So just growth overall, I think, has been helpful.
Did you know that you can find the most experienced and professional orthopedic team right here in the Valley? At Youngstown Orthopaedic Associates, we've been providing all-inclusive care to Valley residents for over 25 years. Our multiple locations include easy access, fully equipped physical therapy centers, and a team of professionals dedicated to improving your performance. You have a choice when it comes to your orthopedic care. Youngstown Orthopaedic Associates, your choice, right here at home.
I'm Joseph Stefko. I've been associated with the practice for 22 years now. My practice specializes in mainly the arthroscopic treatment of shoulder and knee pathology. I also have a high concentration of reconstructive surgeries over the shoulder, where I do shoulder replacement surgeries. The arthroscopic treatment is minimally invasive surgery, where the surgery is done through little puncture wounds using little viewing telescopes. By using those techniques, we're causing less tissue damage, there's overall less pain, and the healing rates are more advantageous. It's usually done on an outpatient surgery, and the benefits of the arthroscopic surgery gives us the opportunity to initiate motion and strengthening activities at a lot sooner rate. The shoulder replacement surgery is done when we get to the point where the patients are not responding to any further conservative measures, then we consider that option. So essentially what we're doing is removing the arthritis segments from the joint and putting in a prosthesis. The surgery is currently done for most cases on a overnight stay, sometimes done on a same-day surgery basis. We have new anesthesia techniques that eliminate the pain from the associated with the surgery. Usually by a month, people are out of their immobilization and utilizing their arm in a much more pain-free fashion. Practicing orthopedics, there's a great affiliation between the surgeon and the physical therapist. Our treatment does not stop at the operating room. It carries over to the actual movement of a joint and the physical therapy protocols. The benefit of having physical therapy at this location gives us the opportunity to tailor-make these protocols so they can be specifically geared to the individual patient. So on a day-to-day basis, I'm involved with the patients in physical therapy. I'm communicating with the therapist and actually observing the patients while they're performing their therapy exercises. Well, the benefits of Youngstown Orthopaedic is the fact that we have multiple subspecialists in orthopedics. We have individuals that have trained in different facets of the specialty, and the benefit is that we rely on everybody's unique expertise in a kind of a team approach on addressing the problems that we're seeing. So on a daily basis, we're seeing little twisted certain pathologies that I commonly recruit the help of my partners, the physicians associated with the practice. You know, whenever a patient has a good result, I consider that a success. I mean, there's individual cases where, you know, I've been involved with the treatment of professional athletes that have continued to excel afterwards, which is success, but I treat all my good results as a success.
The primary focus of my practice is on adult arthritis. So patients, when they see me, they've been having significant pain in their knee or their hip for at least 6 months, but oftentimes for many years. And this is something that's progressed and has really impacted their quality of life. So when we perform a hip or a knee replacement, both of those procedures are associated with excellent pain relief and restoration of function. So it's very satisfying to see someone be able to get back to work without pain or enjoy their recreational activities and their family without a problem with their hip or knee. Most patients that I operate on are candidates for minimally invasive hip and knee replacement, where we're able to accomplish the surgery through a smaller incision with less pain and earlier recovery than traditional surgery. Some of the redo or revision joint replacements are done through a more standard incision. One of the great assets of our practice is this one-stop shopping, where you can see the physician and then have a referral to physical therapy or occupational therapy to start your rehab soon after your surgery. Most patients are able to go home after a day or two in the hospital, and they may receive home care for a week or two until they're able to drive, but then they start right here in our outpatient therapy department where their rehab will pick up. I would say one of the other things that we've been focusing on is partial knee replacements. Not everyone would be a candidate, but about 20 to 25% of the patients will have localized arthritis that affects one part of the knee, where the other parts of the knee are essentially normal. So if you're a candidate for a partial knee replacement, it is a very nice procedure because it is successful in relieving your pain, and the recovery is much faster than a standard knee replacement. Many times in a partial knee replacement scenario, you can go home the same day as the procedure. So it's an outpatient procedure that takes about 60 to 90 minutes. And then you go home in the afternoon, and the home care therapist will be there to see you on the same day. So usually by 2 weeks, you're off of a walker and a cane. You've restored the motion in your knee, you're returning to driving, and you're attending outpatient physical therapy to get stronger and in preparation to get back to work earlier than some of the other more traditional procedures. One of the nice attributes of our practice is having a specialist in essentially every area. So if someone's coming to see me for a hip or knee problem, but then they develop an issue with their elbow or their shoulder, I have a partner that I can send them to right away so that they can get that evaluated and be treated by someone who is truly dedicated to fixing that joint.